Laurie DeJean and a management team from LDJ Productions flew from New York to Kampala before boarding a bush plane and flying west across the country towards the border with the Congo. It's a trip most visitors make to go on safari, to see the wildlife. But Laurie's mission was quite different, as she explained to pilot Jim Foley.
Working on a project for a foundation that we have. One of our projects is working with a community down in a region called Kasese. And what we're doing down there is opening up a health center for preventative medicine, for consultation.
Is it visited Kasese town?
No, it's a village within the mountainous region called Kihara. Previously, all of the residents would have to cross the river by foot to get to the health center in Kasese. So what we're doing is we're building a new health center in Kihara.
Kihara is an impoverished township where many of the residents are subsistence farmers, living on less than $1.25 a day. A hard life in a beautiful country. Once off the plane, they met with Robert Centenary, their man on the ground, whose initiative had helped launch the project. And together they drove to the river that separates the inhabitants of Kihara from the health services in Kasese.
And this is River Nyamwamba, which has been bursting its banks for the last 2 years. They do not have a health center here. The closest health center that they have, you have to walk through the river to get to it. Annually, 15 people were drowning in that river as they cross.
I think it's amazing that 50,000 people have absolutely no access to health care whatsoever. And if you're that sick, you have to be carried across in a human ambulance. Chances of survival if you're that sick are pretty slim. So the need for this health center is pretty drastic.
En route to the site, they stopped off at Kasese's existing health center.
This health facility is a model for the one we are going to build in Kihara. They provide basic health care services. When there are serious cases, they refer them to a health center 3 or 4 or a hospital.
Like this center, the new building will track infections, screen for communicable diseases, and allow patients to consult with a nurse, all of which will save lives.
This is real-time tracking of malaria and then measles over here.
They then had a kidney-crushing 15-kilometre ride on a heavily rutted, unpaved road, all of which was soon forgotten when they arrived at the construction site and found that work was well underway. And they were humbled by a welcome reception that brought the whole community together. The team are here as part of LDJ's charitable wing, the Paper Fig Foundation, which has a wide-ranging mandate to empower communities in need. After the singing, dancing and speeches, they helped out with the construction, ceremonially placing a few bricks in the walls of the future health centre.
The excitement in the community reveals it all. The people are really so happy. They are so grateful to this gift of the health center.